Let's talk about rib fractures. The pain from rib fractures diminishes respiration, resulting in atelectasis. Atelectasis is collapse of the alveoli, the small air sacs, and this can increase risk for pneumonia. So rib fractures, the pain from rib fractures can result in pneumonia. Fractured ribs can also puncture the lungs, resulting in pneumothorax, and worse yet, tension pneumothorax. But don't forget, those ribs can fracture and puncture the heart, the liver, the spleen, the gastrointestinal tract, the kidneys, and so we want to think about the surrounding structures when we think about fractures of bones. Well, here's an X-ray of a massive tension pneumothorax. Well, here, our massive tension pneumothorax has compressed the chest contents to the opposite side of the body, and this can be lethal in a matter of minutes. This air in the pleural space here has compressed on the chest contents, and so both lungs and the mediastinum are over here on the other side. Because the heart and the great vessels are being pressed on with such great pressure, that the heart cannot fill with blood, and if the heart cannot fill with blood, it cannot pump blood, and if the heart cannot pump blood, that is a lethal problem. Something we'll see with a tension pneumothorax is tracheal deviation. Maybe you can see that on the X-ray. The trachea has been pushed away from the side of the pneumothorax. You can also see that the diaphragm is under pressure and has been pushed way down. And so with rib fractures that puncture the lungs, sometimes we'll be able to detect subcutaneous emphysema. We can see that here on the X-ray. Here's a close-up. Subcutaneous, under the skin, emphysema means air trapping. And so for somebody who has subcutaneous emphysema, we'll be able to feel that. We'll be able to palpate that. So somebody with a rib fracture, if we palpate the surrounding area and feel subcutaneous emphysema, we feel the crepitus from this subcutaneous emphysema, then we can know that the lungs have been punctured. In a tension pneumothorax this severe is lethal. This is a post-mortem X-ray from trauma.org, the trauma website. Here is an anatomic drawing of the pelvis, and I wanted you to take a look at all the major vessels that run through the pelvis. Here we see the aorta divide into the iliacs, and here we see the iliac veins draining into the inferior vena cava. So pelvic fractures are especially concerning because of the large blood vessels that lay against and pass through the pelvis. So here's some pelvis X-rays that we can take a look at. See if you can see the fracture on here. So we see the irregular margins of the bone here and along here, and so we can see these fractures. And again, because major blood vessels run through the pelvis, these fractures can be lethal. Here is the fracture on this X-ray. Here we can see the pubic symphysis has been dislocated, as well as the sacroiliac joint. And here's a very profound pelvic fracture. And again, pelvic fractures are especially concerning because of those large vessels that pass through the pelvis. And so here's an open or compound fracture of the pelvis, and these can be very lethal injuries. So remember, the complication of fractures depends on the bone involved in the surrounding organs, so always keep in mind the surrounding structures. Here is an X-ray of a femur fracture. Can you see what's going on here? I'll give you a hint. You can see the parts of the spine board here on this X-ray. You have to ignore that. Well, here's another hint. There's the upper part of the femur, the lower or distal part of the femur. You can see that it is angulated and displaced. And there's a bone fragment back there, so this is comminuted. Do you see what else is going on with this X-ray? I'm going to draw your attention to that little spot on the X-ray right there, a little fuzzy spot. What do you think that means? Well, this is especially concerning because of the surrounding structures. And what runs along the medial edge of the femur? The femoral artery. And so here we see a hematoma, which is why we see that fuzzy spot on X-ray. And so this X-ray denotes not only a femoral fracture, but hematoma due to femoral artery laceration. Here's the same patient with a X-ray of their pelvis. I wanted to see if you saw anything out of the ordinary with this X-ray. I want to draw your attention to this right here, the other femoral fracture. This patient has bilateral femoral fractures. And notice this is slightly displaced and displaced superiorly. So what is the mechanism of injury in bilateral femoral fractures? Well, what direction do you think the impact is? And we can see the vector of impact is upward through the leg and through the thigh. So femoral fractures are common in sudden impact car crashes. Now we're going to go through this animation. When I served as coroner, I went out and saw fatalities of all sorts of motor vehicle accidents. And something that I noticed in sudden impact car crashes was lacerations through the skin and cutting of the clothes in a very linear fashion above the thighs and above the arms. I found that very peculiar and didn't think about it too much until I started getting ready to make this lecture. So here's an animation of a femoral fracture with a sudden impact car crash. So here's the brake squealing, and then the crash. Maybe that was too fast for you. We'll go back and do that in slow motion. Crash. And notice that the sharp edge of that bone is going to act like a knife. And just because we see the parts laid like this on the X-ray, you can assume that with this mechanism of injury, that this sharp edge has gone up and made major laceration injuries all up through the thigh and leg. And we can tell that because of the hematoma right here. And so this would indicate a high risk for femoral artery laceration, which can be lethal in a matter of minutes. You can exsanguinate, you can bleed to death into your leg. So femoral fractures can be lethal whether they are opened or closed. And so don't be surprised if you see fractures that have caused severe laceration or cutting of the skin and even overlying clothing. So long bone fracture complications have to do with the surrounding structures. If they lacerate an artery, we can have hemorrhage. If they lacerate or damage a nerve, we can have nerve damage. Compound or open fractures have infection risks. And then fat embolism is another complication where parts of the marrow can break loose and enter the pulmonary circulation, causing fat embolism.